Recording in progress.
Actually, I don't want to do that. Oop.
Are you licensed to drive that thing?
No.
All
There we are. Now we'll make it bigger.
right, so what do we have? We got PJ. We got Lynn. You've got Jeffina. And Steve here. Accomplished.
I was in my office on a Zoom call and we lost power and a loud pop. As I was aware of the extent of the damage unfolding, I called my boss and said we would have to call quick response right away.
All right, for those in person and virtually here, 6:01, and we do have quorum. So we'll begin with Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with liberty and justice for all. So as it relates to minutes, they're recorded, so we don't necessarily to approve them because it's a transcript from a recording, or it's just the recording. Excused members for this evening are Alan Wood and Alan Bell and Dennis Wood. That's a faux pas. Love it. Next item would be Executive Director's Report.
Okay, a few things on there related to ARMS, but I'll start with our training update. In regards to our last fast track class, which wrapped up, I believe, late November, early December. Actually, those students have started testing out, which is great. We vouched for and received I say 12K, but actually I think it's up to about 14 from that class. That class will turn a profit, despite the fact that we had about 8 or 10 kids drop out. But that's good. They're testing on a regular basis. Our 2024 winter slate of classes has started. SUNY Albany, and they started last week. Skidmore College starts the 24th, and Glens Falls starts this week. So we got 3 classes in process. Now we go to Ahrams. Participated on a WebEx on January 4th to discuss late payments. If folks aren't aware, DOH is deficient by 8 to 9 months in voucher contract payments to us, both for Ahrams and Remo. Ahrams particularly has become an issue. So I requested and received a conference call with several DOH contract managers, and Deputy Director DeZura participated on the DOH end. On our end, it was myself, our bookkeeper, Dave Kowalski, and Chairman Jim Stairs who were there. And we talked pretty much at length, but never got a hard, fast answer when we're going to see the money. Process-wise, I think a few things were squared up or cleared up. These contracts are expenditure-based, which will come into play in the next item I talk about. So basically, you have to spend money to receive money. And that's going to segue right into the second part of this Ahrams thing, because Ahrams had no money to spend. We've been basically fronting the costs for anything Ahrams related on the program agency side for about the last 9 months or so. And we're wondering when we're going to get money, and we're wondering how we're going to get money, especially since this stuff is, quote, expenditure based. So we really didn't get any answers on the DOH end as to how they put it this way. They didn't offer any suggestions on how we can raise some money, then turn voucher them for the expenses and get reimbursed. The one contract manager on the call made the comment that she wouldn't care if we held a spaghetti dinner. So I guess that's how we're dealing with this and who we're dealing with. So we came up with a plan to try to realize state repayment. And Dave Kowalski, our bookkeeper, should be on the Zoom right now to explain. But what we discussed between myself, Dave, Chairman Stairs, and Treasurer PJ Keeler was to have Remo basically loan Ahrams some money, which we could go back, re-voucher for. Dave is going to explain it much more detail. And once those contractor vouchers came in, Ahrams would repay us the loan with interest included. But I'd ask Chairman Stairs to see if Jim or Dave Kowalski is on, because I'd like him to explain it in detail from a bookkeeper accounting aspect.
Okay, Tim, what we got is the situation as you just explained. The state will not allow you to voucher for any money until the money has been expended out of the grant, and then it's just a reimbursement. Unfortunately, with Ahrams not having any money available front to go and pay its bills, we've been doing invoicing as an accounts receivable. According to the state, the accounts receivable is not sufficient for a reimbursement. They actually have to expend the money paying Remo. So the only way that we were able to come up with that Ahrams would be able to get money would be to advance a loan to Ahrams through the RBC account, at which point Ahrams would pay its obligation to Remo for their expenses incurred. Once they go and pay Remo, then they have the expenditure and you can submit to the state for reimbursement. It's kind of a shell game. It's kind of confusing, but this is truly the only way that we were able to figure that we would be able to go and have Ahrams go and pay their bill to Remo so that they could be reimbursed.
Dave, this is PJ. Just a quick question. Do we receive and do other Remscos receive money that's reimbursed on an expense based for our program grant?
That is correct. That's the way that the contract is written. We went through and researched the contract. It never used to be that way. They used to allow where you had an accounts receivable, as long as there was a purchase order and everything. That used to be allowed, and sometime in the last couple of years, they changed the wording on the contracts that now it is only reimbursement based. They will only pay for expenses that have been incurred or actually expended. I'm sorry, because a payable would be incurred.
So they're trying to put us all out of business.
Yeah, unfortunately, like I said, I don't like this whole system. It feels like playing a shell game. Uh, but the state's answer to us was they don't care where the money comes from, just as long as the money is expended, and that's the only way that they will reimburse.
So if we advance them the 60-some thousand dollars, they turn around and pay us back for that. There's still no guarantee that it won't be 9 months or a year down the road before they get funded, correct?
That's correct, but what we can do is we can send in those vouchers that show the expenditures, because basically what we're down to with the expenditure reports for ARMS is it's a one line item expenditure. We show and that's contractual services for Remo providing program services for the ARMS. So once they expend and reimburse Remo for that amount, and there's a check that has been sent out, I don't see why there would be any holdups on reimbursing. I mean, it should be a very simple process for them to do it. That being said, uh, Shannon Bensala has me tearing my hair out, and she's a very difficult person to deal with. So hopefully everything will be going straightforward. And then once ARMS does receive the reimbursement from the state, that will go right back into RBC to reimburse from the loan. We will also charge ARMS an interest fee, which will be able to be charged to the state because it is an expenditure related to their program services.
So essentially, we'll have to do this for every quarter, correct?
I'm hoping that once we get caught up and once we get uh, some money flowing into ARMS, that it should take care of itself. Because basically what we'll do is we'll have the advance in the quarter to go and pay their expenses that when Remo generates an invoice for them. The problem is that we have not received any reimbursements uh, on the ARMS account since March.
Yep, I understand. And my only advice or caution on this, would you and Tim check with Stephanie Mumford on this? Make sure this is copastiche.
Absolutely.
May I ask a question?
Absolutely, go ahead.
Um, so this is a problem that ARMS is having because they don't charge the students ahead like Remo does. Is that correct?
No, ARMS is not involved in training at all. ARMS is strictly a program agency contractor for the state.
Okay, so this is ARMS money, but not Remo money because students are paying their bills up front and we have enough money to do our thing. Is that correct, Dave?
Right. This doesn't have anything to do with training or any courses or anything like this. This is strictly a program agency contract issue with New York State.
Thank you very much.
Okay.
So, David, this is Steve. So essentially, ARMS came into this agreement with $0, right, in assets?
That's correct. Unbeknownst to us, they had some loans out and everything that they used to settle up when they received their contract payment in March. And then they had a little surplus that we used to pay some of their bills that were coming due in the name of ARMS.
Okay.
And we had enough to go and pay Remo for the first quarter because we had a very small expenditure to go and cover costs because it was such a short period. The problem is that third quarter is still outstanding. Once they free up that third quarter, I believe that amount is approximately $30,000. That should give us liquidity so that we can start the flow of funds so that they will have money in their accounts so that they will be able to pay Remo when we go and generate the invoice at the end of the quarter for them.
Okay, so you will catch up and have some liquidity, and this is not gonna be a permanent loan pool, so to speak.
That's correct.
Okay, well, I think you've got a good plan. But I also just want to make a suggestion for Tim. I don't think, I mean, I understand how state vouchering works, but I also understand that Remo sort of, we took on a problem that, you know, in a way by offering to help a region that didn't have a plan, getting involved. I think you should come to the finance committee at the next Remsco meeting and bring this up. So it's the day, you know, I think you should come as a program, you know, bring it up and say, look, you know, we wanted to do something that was innovative and helpful, and, you know, everyone supported us doing it
At DOH recommendation.
at DOH recommendation, because that gets it on the record. It gets it in front of the finance committee of the Remsco. It'll be read in, you know, it'll become discussed at the Remsco meeting. And maybe there can be some sort of policy change so that when this type of thing occurs, that there's a way to I mean, you know, I think Dave's come up with a good shell game, but it still is, you know, the interest we're gonna be charging is probably not the same as we're gonna get as our return on investment, right? In the market the way it is today. So I think that the state ought to be thinking about how they, and we're not gonna be the only program agency that does something like this, right? So you might have colleagues that are in the same boat that have done something like this, and maybe you can bring it to Remsco and make it a discussion, at least gets it on the record, gets it discussed. Because, you know, someone telling you you ought to have a bake sale is pretty disrespectful.
Spaghetti dinner.
Spaghetti dinner of the work that we are doing or that you are doing for a multi-county region of our state.
Right. It was very unprofessional. Tim and I had also spoken to Susie Supernat, and just to find out if we're the only region that is experiencing this problem. Every single region throughout the state is having this problem.
Well, Tim, you and I should catch up
Tardy payments.
separately.
He's talking about tardy payments.
Yeah, I mean, so, you know, we always open the floor at the committee meetings for people that have things they want to bring up, you know, so
Right.
I'm sure you could be able to bring it up, mention it.
All right. Thank you,
Steve, that's a
Dave.
great idea.
Yeah, I was gonna say, the only thing I'll throw in from the conversation that occurred during the course of this meeting is we did ask, and I just checked with Jim to see if the state ever replied. Was there any method by which we would do the process that we're describing that would have been prohibited? And we didn't get any reply back. You know, and specifically the conversation we had offline was, do we actually have to go to a bank and borrow money, or can we do, you know, what we're describing here? But they never replied, so we're assuming we can do what we're gonna do. So that's
We're gonna run by TBC just to be safe.
yeah.
Okay, we kind of got off tangent, but I thought that was important. It segued into the two ARMS items. I still have a couple items just to bring up, and then I'll conclude my report. Unless anybody else has any questions there regarding that.
Tim, it's PJ. Maybe this is the time to approach the bank about our line of credit.
I mean, that's your call, or that's this body's call.
Well, I mean, I'm not against loaning the money at all, but by the same token is, you know, rather than taking the money out of our investment funds, if we can establish a line of credit for $60,000-$70,000 and we're going to charge interest, you know, that would probably be the way to go, because hopefully it's state guaranteed money.
I mean, I'm okay with that. Is that something that everybody wants to discuss? And
I would pursue that first, and if that doesn't work out, we'll have to go the other way. My opinion only.
A motion?
I'll make it a motion.
Second it.
I think the line of credit's a good idea, but you'd be essentially securing the line of credit with your RBC holdings. Right?
Correct.
So, you know, the
Correct.
bank should be willing to give it to us. But then you're gonna be my assumption is we'd be borrowing the money at a lower interest rate than RBC on a line of credit than RBC could earn. And so if it was the opposite way, it might not make sense, but given the way the market is performing right now, it depends on the terms that PJ can negotiate with the bank as to whether, you know, if the bank comes back and the line of credit's 12%, you know, that would not be favorable to us financially. But if it comes back at 4%, it might be favorable. So I think we should give PJ the option, but not the mandate. You have to decide if it's a good financially, if the line of credit is a better deal for us.
But by the same token, Steve, if they charge us 12%, we're passing that along to Aaron's.
Will the state pay interest? You voucher for the interest?
You can voucher for the interest, yes.
Yes.
pension, yeah.
Okay.
Excuse me, I just want to interject here. I think that if we're going to do this, then the proper way to do it would be to have ARMS apply for the loan. Because it's going to be their obligation.
Yeah, but they have no assets, right? How could they get a line of credit with no assets? You'd be getting
That's correct. That's the problem.
Yeah, I mean, you have $300,000 in cash, investments to secure that a bank's gonna go. You know, these guys aren't gonna walk away on us.
Yeah, so that was kind of my question is it Remo, the program agency, or Remo, the region that's looking for that line of credit?
It would be the program agency.
Got it.
I was going to say not to, certainly people here on the joining virtually are welcome to continue to ask questions. I just wanted to, for our attendance, who is last 41419 for a phone number?
That would be me, Rich Salucci.
Okay, thank you, Rich. And the other one that I don't have a identifier for is that there's someone who just shows up as iPhone 7.
Believe that's me. It's Jeremiah Rod, if that's me showing up there.
Yep, no, that's good. And yeah, that's how you showed up was iPhone 7. Thank you for that. And anyway, any other questions on the motion? All right, anyone wishing to vote no or abstain? All right, without either, we'll call it a motion carried.
So just to clarify, is that to have us contact Key Bank to establish the line of credit? Was that what that was for, or was that?
I think we need to clarify that. I think that's option A, is to see if we can't get a line of credit. Option B, obviously, if we can't, or we can't get the amount that we require, that we be allowed to take the funds from RBC rather than stall it another month.
Okay, I understand, as long as everybody else does.
Yeah, and I think Tim was just clarifying, you know, his marching orders and what the motion was. So excellent, thank you.
Okay, I just had a couple other quick items to conclude the report. Went up to Johnstown to attend the ARMS meeting last week. Nothing major report from there. The only other thing, which Chairman Stairs will address, you know, shortly down the agenda, is the Ashland declaration to establish permanent operating certificate. Public hearing was held on January 10th. No opposition, short meeting, and everything was done there, but Jim will speak to that a little bit more. So I'm sorry, but that all got off on a tangent there, but that concludes my report.
Any questions for Tim? Very good. Nothing in terms of a chairperson's report. I don't think we have anything that wouldn't be covered, that might be covered under, issue discussions up to operational. Dr. Daly, medical director.
So it's actually been an interesting couple of days. I've been clinical in the emergency department for the last few days, and it's been wonderful. I've been practicing emergency medicine the way I wanted to. I've been greeting paramedics as they came in the door and watching them then leave. And patients have been flowing through the department the way they're supposed to. I'm guessing this is an anomaly. We'll go right back to everybody waiting on the ramp shortly, but honestly, it's been really nice. The things that I think that are most important from my perspective right now, the governor's budget bill has been announced. I encourage all of you to take a look at it. There's some language specific to EMS, which quite frankly looks like it's written really nicely. There's one thing that's pertinent to a program that we've discussed here before, where the language is actually spot on, where we had talked about the idea of adding buprenorphine to our rural EMS colleagues so we can treat opioid withdrawal in the field. That language would be permissive in the changes to Article 33. So take a look at the budget bill. I think it's important for us, and there's a lot of opportunity there. So most important things on my agenda right now, Mr. Stairs. Thank you.
You want to do QI if there's anything while you're have the floor?
We haven't had meetings of late, and February meetings will actually be bumped to March because of the schedule for the CMAC.
Pretty good. Dr. McHugh, REMAC?
Nothing much. Haven't had a meeting since we had December's meeting. Pulsera has been a significant improvement for the hospitals in the area when we have beds available to make it help the flow. When we're log jammed, it doesn't make much of a difference, but it definitely does help when we can. Other than that, I don't think there was much else at the December meeting, so we'll be meeting in March as well.
Very good. PJ, treasurers?
Yep. Despite what you just heard, as of the end of December, we're in fairly good financial shape. However, most of it is in receivables, which you've just heard about. Grants receivable and the ARMS receivable is tying us up significantly. So in full transparency, we've had to take another $30,000 out of our RBC account to slug in there to help us get through this. So hopefully the state starts freeing some money up and we are able to pay some of this back. Of particular note, the training has helped significantly in December, where we had almost $49,000 worth of income. So that's it.
Very good. Next items are related to information sharing. We don't have any disciplinary actions or course applications or even correspondence, so saves me some time speaking. Committee reports. The executive committee did not meet since our last meeting. Finance, Steve Kroll.
I have no report. The finance committee our investment portfolio is not growing right now in the sense that we're not putting new money in there. We're just trying to not borrow it ourselves. But our portfolio is performing with the market. And, every once in a while, PJ and I take a look at the portfolio. We haven't, recently done it, but it's a good market. We're doing well in what we get back. And our hope is that we are able to, be building assets, not using assets in the future. And I'd ask PJ if he'd add anything to that.
No, I agree. Building versus using. But in the meantime, thank God we have the funds to be able to use. Otherwise, I don't know where we'd be.
Excellent. Anything, Steve, from New York State EMS Council?
Yeah, wow. I'll make it as brief as I can, but some stuff going on. First of all, we submitted the names of Steve and Carol to the state for the delegate from Remo. Every time there's a meeting, I check to see if one of you guys has been vetted by the governor's office, and I'm off the hook. And we have not gotten the vetted back, and so I don't know, we don't know which one of you is gonna get picked, and we don't know when it's gonna clear the process. It is now an election year, which means, but it's not a gubernatorial election year, but in election years, the governor's appointment office is even slower than non-election years. I still go to the meetings and, you know, sit at the table until one of you guys gets picked. But hopefully they'll, you know, I've done my time. Hopefully one of you guys will get selected, but I know Carol is now serving on several committees, and I think she's even chairing a work group now. So, you know, we appreciate that that contribution from you to the State EMS Council. So we did meet in December, and we didn't meet in December, so I'll give you an update on that. And then we're meeting again in about a week, 2 weeks from now. Actually, we meet the same day as the REMAC meeting is scheduled for. There is a new MOLS policy statement that came out in December. I think Tim sent it to everybody. It's a really good policy statement in that it clears up a lot of questions that we have. I wanted to draw its attention to everybody because we've been making the rounds of our assisted living and nursing homes in our community to make sure they understand this MOLS policy statement, because that's always been an area of friction for us with our continuing care providers. And now we actually have some pretty clear guidance from the Department of Health on what we're supposed to be doing. And so I've been putting in front of them and saying, we're going to be living by this document. You have to live by it too. And I don't know that, I'm sure they got it somehow through the regulatory process, but I'm not sure they're putting one and one together. So I advise everyone, look at the MOLS policy statement, make sure your crews are familiar with it, because they're the ones that are on the front line when they walk in and they're saying, you know, when they're looking for those advanced directives. There was something Tim sent out today that was discussed at the last meeting. I'm not sure that we have a lot of agencies that are using critical care techs in our region anymore. But if you're using critical care, the SEMSCO and CMAC voted 7 years ago to do away with critical care tech in about 10 years. So we're like at that sunset date, getting very close. So the Training and Education Committee is now working on a plan to either get the remaining critical care techs bridged to EMTP, or get them AEMT cards and do away with the critical care tech. This is not without controversy, but the decision was made 7 years ago, and I think there are a lot of people that are going to stick with that decision. And so if you are using EMTCCs, there's a survey that went out today to gather information on who is using them and how they're being used. If you have an interest in that, it's very important that you return that survey, because in the next 2 or 3 months, the SEMSCO and CMAC will make whatever final decision they make. My suspicion is that the decision is going to be that we said 10 years, and 10 years is coming on July 1st, 2027, and that's it. So if that's okay. I know not everyone here, most of us here are urban, but for the few of us that are rural, the Rural Health Task Force that the governor has appointed is nearing the completion of their report. They have held several town hall meetings, and those town hall meetings are going on. 2 of them, I think that they just got announced. If you're interested in participating, have the input, you should definitely do that. The SEMSCO is developing regulations that would mandate agencies to have a policy of motor vehicle operations and specify necessary topics that must be addressed in the policy. If you've got an interest in that, definitely you should be following what the SEMSCO Safety Committee is doing. I believe that the policy is most likely not to tell you how you have to do your motor vehicle operations, but it's going to say, what are the things your policy has to have in? So it's meant to not be a prescriptive policy, but make sure that, yes, we have considered things like speed. We have considered things like when we respond lights and sirens. So if that's something your agency is interested in, that's something I think you should be following. Mike mentioned that the New York budgets come out. There are 8 things I want to mention in there that if you're interested in, you should be watching. This will be the topic of a lot of discussion if you're a member of Onion, if you're a member of NYSFERA. I chair the NYSFERA Legislative Committee, so I've gone through it with a fine-tooth comb already. I'm just going to tell you what the topics are. I'd be glad to talk with any of you about it. NYSFERA is going to have a webinar for its members in a couple of weeks, February 13th. First thing is, there's no new money for Medicaid ambulance rates, so we are not getting an increase. That's something that we really think we should be getting because we're still paid below cost. A lot of people are not getting increases this year. Number 2, there is really no investment in workforce in there. And again, that's something we think there needs to be an investment in workforce because we just finished a workforce report that I think I shared with Tim and he shared with everybody here. And if not, I can share with Tim, he can send around. Basically says we've got about 15% less EMTs than paramedics than we had 3 years ago. So those are the 2 things that are not in the budget. Here's the 6 things that are. Number 1 is an expanded definition of EMS. And the governor has recommended the definition that the Remsco and NYSFERA and Onion have put forward. And that definition will be a definition that will allow us to finally operate in non-emergent situations. In other words, it takes away the argument that we can't do things like community paramedicine because right now we're only supposed to use our skills in emergencies. So that's number 1. Number 2, there's language on making EMS an essential service. That is not going to be without some controversy, and there are a couple things in there that are really interesting. Emergency medical dispatch is proposed to fall under new requirements overseen by the Department of Health. I don't think that is probably going to set off as many alarm bells among us as it is among county and municipal governments. They're going to go nuts. This is a big change to have them being regulated by the Department of Health. But if you're an agency that has your own PSAP, you ought to be paying attention because like for example, a commercial ambulance service, if you have your own dispatch center, will you now have to be licensed to do that dispatching under the Department of Health and meet certain requirements? So you should be looking at that. The bill reduces, but this is all in the governor's budget. The legislature gets their chance at it. This hasn't all happened. This is all what the governor proposed. Next, the bill reduces the burden for counties to obtain a certificate of need for the operation of county ambulance services. I know in my county, this is not a problem where I live because we have a county ambulance service and we all have a good relationship with the county ambulance service. And we're not like trying to steal calls from each other or knife each other in the back or anything like that. But I can tell you that one of the Ames counties talked to me today and they're kind of upset about it because their they feel like the county ambulance service is trying to expand at the to the detriment of some of the other people, some of the agencies currently existing. So that's something that people are going to have to look at. The bill proposes new language that will give the Department of Health, with the approval of the State EMS Council, authority to establish minimum standards for the licensure of EMS practitioners. So the word licensure is being used by the governor, not certification. So today we're certified. They're talking about us being licensed. I don't know exactly what the difference between certified and licensed is. But they're also including in there establishing licensure standards for specialized credentials like critical care paramedic. I think that's something that people at the Remsco have wanted, right? How do we certify critical care paramedics? But they also have therein approval for emergency vehicle operators, field training officer, EMS administrator. That's a lot of space where they can make new requirements. And it's something definitely that I think everyone here probably has to think about how it fits together for us. So that's the stuff in the essential service bill. There's a program called Acute Care Hospital at Home that's going to be expanded. It used to be hospitals, home care agency, and physicians could collaborate to deliver services to people in their homes. They are adding EMS into that program. So that means that EMS agencies can now work with hospitals, nursing homes, home care agencies, hospices to come up with ways to help people in their homes instead of in the hospital. Again, takes us down the road towards community paramedicine. There is express permission for community paramedicine. Last year, they passed a bill that said the community paramedicine programs that were established under the governor's executive order during the COVID emergency could operate for 2 more years. That 2-year window has been moved to 2031. So anybody who now is doing something in community paramedicine has got till 2031. So it becomes an 8 more year window. And they're going to allow people to apply to be community paramedicine programs. There are up to 200 more programs. So that means if you weren't in that group, you can apply to be in that group. So 200 is a pretty good number. There is a statewide EMS supplementation task force, and the state is going to be divided into 5 zones. And in those zones, the Department of Health Bureau of EMS is going to have the ability to provide supplemental ambulance service in crisis moments. So if you think about Buffalo last year when they had the huge storm and the Department of Health sent out emails saying, hey, everybody, who can send an ambulance to Buffalo? They sent that email out actually a week or 2 ago, but it doesn't look like it rose to that level of crisis with their blizzard this year. Those task forces, we don't know exactly who's going to be staffing those task forces, but that's out there, that the state is going to have a ready set of responders and they're going to buy some equipment. They're going to be and that we can be staffing those. The last thing is, and I think this is probably not a Remo issue, but there'll be a rural paramedic telemedicine urgent care program. So in rural communities, a hospital or doctor can set up an urgent care clinic staffed by a paramedic that basically does a telemedicine visit with a doctor. So a lot of this stuff is in the community paramedicine and mobile integrated health area. I think a lot of us have been asking to be able to do some of this stuff, but I think one of the things people have been concerned about is that our workforce is kind of in shambles, right? We're all trying to find enough EMTs and paramedics, and there are going to be a lot of new opportunities for EMTs and paramedics. And we can't say, gosh, don't innovate because we don't have enough EMTs and paramedics, but it adds back to we need workforce development. So that's what's in the governor's budget. There's quite a bit, actually. A lot of input went to them from the State EMS Council, from some of the committees. Now the legislature gets their crack, but I thought everyone would want to just know what's in there. I've got all the, you can pull the bills down and read it yourself. But I thought it would be good just to share the top lines with everybody. And as Mike already talked about, the buprenorphine that's in there, that's pretty good.
Any questions for Steve? Very good. Anne Marie, nurses?
Yeah, we met on January 18th, last Thursday. We had invited Angie Cunningham from Pulsera to come and speak with us about the functionality of Pulsera and some of the options that they have. Many of the hospitals were using it better than others, and I think it was really like an educational deficit on from many of the hospital nurses. So she did a really nice presentation. She actually took up almost the entire hour, but it was very informative. We really had asked about the 12 lead EKG transmission in lieu of LifeNet. So it looks like that will be able to we'll be able to have that with the paid version. Right now, the hospitals have Pulsera free version, and with the paid functionality, the hospital side communication. We were able to notify the advanced treatment units and get the 12 lead EKG as well. The charge nurse will receive, so she really went through all of kind of the steps, but I highlighted just a few of the things that she had talked about that would be pertinent for here. The charge nurses will receive an audible alert for all EMS patient intake and pending. We can create teams within Pulsera that will trigger an audible alert, and if they can toggle on and off for the healthcare provider teams in order to send alerts, for instance, interventional cardiology. So patients having a STEMI, they can get on and off as we need them to. Alert from EMS will show patient types, chief complaint. it'll allow the user to show the patient name. Patient arrival time can be changed as the intake is performed. And this will allow the hospitals to get door in and door out times if they put down the exact time that the patient arrives. Patient will stay on the list until they are stopped and cleared, or until you set an amount of time for the stop cases to follow up the patient channel. She suggested it was good to leave the patients on for at least 4 to 72 hours for follow-up by EMS or by ED staff when giving report to the floors. Numerous surrounding regions are involved with Pulsera, so you can receive patients from those programs who have adopted Pulsera, and this will decrease the amount of phone calls, which has really been a big concern from the EMS side, and they brought this to us, and we brought this back to the nurse committee. So this is one of the functionalities that will help to decrease that. That'll be a big win. Let's see, the tiered EMS response care level and patient handoffs will be noted in the patient channel as well. So a lot of the things that we've been talking about and discussing, it seems like this will, allow that to be rectified, hopefully. Hospitals can set availability when the capabilities are exhausted. This will notify EMS teams of momentary limitations and wait times, so they can also do that. Dr. Daly had asked on the call that if a patient is coming from a community hospital, needs to go to Albany Med, can the community hospital create a patient channel and put it out to multiple EMS agencies for transfer? And Angie said yes, that you can create a priority list as well as add transport needs for EMS transport dispatch. A virtual transport center can be created to make it shareable and not violate contracts and the right to first refusal, etc. There's a consult button, handoff button, etc. You can add permission slips and patient charts so that the EMS transport can see and access in case physical forms are misplaced. And that was pretty much what she covered. I know she gave a lot of the answer.
I think the most important thing about that, Amory, is, Pulsera has been an extremely functional part of what we're doing here over the course of the last year or so. It's reducing turnover times. It's improving our communication with our pre-hospital providers. Frankly, the nurses at Albany Med in particular absolutely love it in terms of being able to get that bi-directional communication and not having additional noise in the department, just being able to do it back and forth by text. And the people that are getting the feedback from Art in particular seem to really appreciate that that's going directly to the people who are involved in the access of care. So I see it as a win-win. I don't see, unfortunately, us currently having the budget to move to Pulsera United, which would give us the additional functionality of being able to get our CAT teams and our trauma teams and our stroke teams engaged with it. I frankly still think it would be a huge boon to what we do. Syracuse is doing that already and seems to be demonstrating great success with it there. But we'll spend some time to go out there at some point towards the summer and see how functional it is there.
So the cost did not come up on the call, but the EKG transmission is upward of $10,000 for LifeNet. So that's what a lot of the nurses are saying.
That's certainly going to be an advantage, and we've already seen that it is an advantage. At the Med, we were talking about how we're going to use it to ultimately create medical control channels, so that when a STEMI transmission comes in and it is the button that's used is Pulsera STEMI, it will also activate the physician. So the physician can then get into the access of communication. So there's one communication message. If somebody needs to talk to me, Steve sends me in a 12 lead. He says, hey, it's a STEMI. He sends it to me into Albany Med. It goes beep, beep on my phone as well, because I'm the doctor that happens to be on right there. I can look down and say, yes, it is. You'll already sent me the most pertinent information. There's nothing else for me to talk to him about. If he wants to talk to me, he can. If not, I can just turn around to the, on that channel and say, patient will go direct to cath lab page will be placed now. Done. no additional wasted time. Anything changes, he can push a button on there and then talk to me and say, hey, I just had to shock the guy. He's still fine because I was there ready to shock him. It's great. It's a step towards improving our communication across the board.
Can I say something about Pulsera? I do think it's a great tool. And when we were originally building it and building it out at St. Peter's Health Partners, we had already gone through our Epic implementation. And I know that Albany Med is still in that process and you will eventually launch. But after Albany Med gets on Pulsera, and Ellis will soon probably be joining the Trinity or St. Peter's Health Partners family, that platform, Epic, will have a functionality very similar to this through their Haiku module. And I think that I realize we're not buying into Pulsera United yet, but I think it's worth investigating after Albany Med gets their feet wet and goes through a couple of the optimizations with Epic to look at this module in Epic, because they will intercommunicate with the two different systems, even though they're on two different platforms. The Haiku will cross over. So I think it's worthwhile keeping that on the back burner with Pulsera, because that just takes one less software out of the loop. Although I do love Pulsera, I'd hate to lose it, but it's definitely an opportunity to unify the whole system.
No, Dean, that's good advice. And Haiku is certainly something that we're already spending a bunch of time looking at in terms of how it's going to be, how that interface is going to work. There certainly are a lot of different things all participating within the same space. Finding what's going to be the best answers is certainly something that's important. Albany Med has also hosted the St. Peter's team at this point. They've come over and looked at how Pulsera is serving us functionally, which has been really helpful. That was a great opportunity. I think the more we can learn from what's happening and working effectively at other institutions, the better we can ultimately serve the community. So.
Dr. Daly, quick clarification. With Pulsera and the LifeNet system, if we have a STEMI, we still transmit over both systems, correct? To Albany Med?
Yes, please. And most importantly, as of right now, and until we clearly integrate the physician into the process, whether you transmit on LifeNet or you transmit on Pulsera, frankly, both is best. You must call and talk to a physician.
Got it. Thank you.
Thank you. At all the hospitals.
All right, I think we're done with Anne Marie Cross's report. And
Oh,
you're still going? Oh, all right.
The other piece was Steve Meehan and actually talked about Pulsera to the nurse committee and gave an overview of what, I'm sorry, I didn't mean to say Pulsera, I mean the missed form, I apologize. And gave an overview and talked about how successful it is at Columbia. Unfortunately, I think many of the hospitals right now feel that with the rollout of Epic and all of the other administrative responsibilities that they have, that they're not going to be able to do anything until the Epic rollout goes live, which is going to be in September. And Art Brielt had mentioned it initially about Albany Med, saying that the Albany Med nurses are absolutely, haven't been about rolling anything out right now. And then Glens Falls and Saratoga actually commented about that after. So
I mean,
we'll revisit it.
that part actually just confuses me because the reason I actually asked Steve to join us on that conversation, and we're going to have more of this discussion offline.
And Glens Falls use it all the time.
Yeah, the use of the MIST form is something that has been regional policy now for 3 years. Glens Falls uses it, Saratoga uses it, Albany Med continues to use it. What we can't do is do any drastic changes to the way it's being used and operationalized right now. But certainly what they've seen at CMH and what Steve did was make it a little bit more concrete than what we had been doing in the past. So I think we just need a little bit of clarification because I'm not really sure that message
came across clearly during that meeting. So we'll be doing some more follow-up on that.
Any questions? And our next meeting is going to be March 21st. We are meeting every other month, just like Remsco.
Very good. Thank you. Sorry for cutting you off there. Next would be MCI PJ Keel.
No report.
Thank you. Membership Lynn Kane.
No report.
Very good, Lynn. Nominating Adam Fink.
No report unless Tim has something. No.
Awards, Carol. Fran.
So awards, it's that time of year again, I guess, to start thinking about it. So, we'll have to send out the award categories so people can start, giving us some nominations. If anybody has ideas on how we can expand the nominations that we've been getting, typically in the past, we just don't get a lot of nominations from our region. So if anybody's got any ideas on how we can increase the nominations that we do get, that would be greatly appreciated. Other than that, I got nothing.
Very good. In terms of county reports, Dennis Wood is excused. Anybody capable of reporting for Albany County?
We're here.
This is Charles Welge. I'll just share that Albany County is in a high level of COVID transmission, consistent with all the respiratory activity that's occurring in the community.
Very good. Although it's not very good, but thank you. Columbia County, Steve Meehan.
The county just a while ago, a number of months ago, elicited Fitch and Associates to do an overall review of the EMS system. That has concluded, and then we had a follow-up 2-day summit with them recently this past week to discuss plans moving forward for years 1, 2, and 3 of how we're going to hopefully be able to implement some of the changes that they've recommended. So hopefully in the coming months, I'll have just information to share about progress that we're making. Other than that, nothing significant.
Very good. Greene County, Steve Neer.
Yeah, a couple things. We are also seeing an increase in COVID transmission, specifically in 2 out of the 3 nursing homes in Catskill. Nothing insane yet, but it's definitely on the rise. And then for those that don't know, Greene County is essentially split into 2 different areas, the valley and the mountaintop. A couple months ago, at the request of some mountaintop town supervisors, they asked the Greene County legislature to do a EMS study on how to, bring people in, retain them, see how we can make it better, see if a countywide ambulance is the answer. And so they're going to move forward with that study. They did a study like this around 10 years ago, although nothing was ever done. So we'll see what happens this time. Other than that, nothing else.
Very good. Thank you. Rensselaer County, Kathy Allen.
I believe Ben is going to be giving a report. Where'd he go?
I'm here. Sorry. Yeah, so for Rensselaer County, one of the things I brought this up in prior meetings, we're revising our MCI and mass violence or shooter incident response policies right now. So either myself or one of my other coordinators is going to try to reach out to some of the other county coordinators to see what you guys currently have and try to not rewrite history here. And that's all I have right now.
Very good. Saratoga County, Tracy Weir.
Nothing to report for Saratoga County.
Very good. Schenectady County, Jim Vina.
We just concluded a meeting this afternoon, just prior to this one, and there's 2 things that I was asked to bring up. One of them, Dr. Daly already clarified with the Pulsera transmission with simultaneously with LifeNet. But the other request was to see if the hospitals could perhaps be a little bit better on updating the hospital availability portion of Pulsera. Numerous agencies have had some conflicting issues or conflicting information come out between the UCC on what hospitals are on diversion or have delays versus what's on the hospital availability portion of Pulsera. So if there's a way for that to be maybe be more real time updated, that would be fantastic. Other than that, I don't believe there's anything else to report.
All right, very good. Thank you, Jim. Under new business, we have updated Remsco bylaws that were distributed, and look to Carol for some
Lynn was-
additional comment.
Sure, Lynn was the chair of the committee. I don't
Oh,
know if she
okay.
wants to
Or
speak on
Lynn?
this.
Okay, so there were very little in the way of changes. It was more or less just bringing it up to be what we are already doing. Did anyone have any questions on the 4 items that were changed? Carol was nice enough to leave in or leave available to read how the bylaws are at this time while inserting what we hope them to say by the end of our next meeting. Any questions, anyone? Mr. Chairman, anyone having questions there?
Nope, I no from the room and no from the Zoom attendants. So
Okay, so we'll see this as being Steve Kroll. Do we need to read these into the record?
Well, Tim has distributed them to everybody, right?
Right.
And so if we had written minutes, yes, but we do not have written minutes. We have
Okay.
recorded minutes. So I think if Jim just states for the record that these have been distributed to everybody and that they are going to be voted on at a future meeting, that should do it.
Thank
Yep,
you. I appreciate that.
and I'll be happy to restate that. But as Steve has mentioned, the proposed changes have been distributed by email to all those members of the group. So look forward to a vote at an upcoming meeting. Next item is a budget amendment to allocate funds for EMS awards.
I'll speak to that if you don't mind. No, one of the last meetings, it was brought up that folks expressed interest in basically resurrecting some type of EMS recognition to coincide with the annual EMS awards. Folks in this room might remember how we had a lot of pretty robust banquets, you know, prior to COVID. COVID did a slam dunk and ended that thing. And then some budget constraints over the last couple of years further curtailed our efforts to hold some type of awards or recognition night. But a lot of folks around the table here and maybe some of the folks on the computer expressed interest in somehow perhaps allocating some funds so we could have some type of recognition night this year to coincide with the annual awards. Be it something we have here, could be a monthly meeting that's abbreviated, so we hold a recognition night after that with maybe a little bit of a catered spread or something like that. So I would defer to the body here to, you know, decide what exactly you want to see, and then we could make it happen.
There was discussion, Carol, Anne Marie, myself, about how nice it would be back to have dinner again. Since we're always talking about work, it would be nice to see our colleagues once again. And we thought that could be done without a great deal of cost. We're not looking for people to volunteer to run it. We're just looking for opinions.
I mean, we could have it here, like I said, after a short meeting or something, set the tables up, the tablecloths, and have some type of catered affair. You know, I don't know if I'd be able to have time to reach out to maybe some of the hospitals or something to schedule something like that. That's a pretty heavy load. But something here would be easily, you know, doable. So if that's, you know, something you guys want to see.
I think it'd be a good idea. Anything's better than nothing.
So I can make it happen, you'd have to, you know, PJ, if he's still on, we'd have to have some type of budget amendment or something, because that wasn't budgeted, you know, for this year's operating budget. But if you want to come back and find some money to have something, I'd be happy to, you know, plan it out. And add in the annual award plaques that we buy too, you know, to the expense, roughly $150 a piece.
Tim, is $2,500 do it, you think, or?
Yeah, I think that'd be fine.
Yeah, well, you get the money from Aaron's and I'm good for 2,500. How's that? I'll make the motion, $2,500 amended budget.
Is there a second? I'll go with second by Anne Marie. Anybody have any questions on that motion? Anyone wishing to vote no or abstain? All right, we'll call it carried. Thank you.
And we just need a plan.
Yes.
So if anybody has some ideas.
Well, maybe I'll work with you because you're on the awards committee,
Yeah, I
and we'll
know.
try to
Hoping you forget
coincide
about
it
that.
with, no awards time.
You had to remind them. The next item is the Town of Ashland CON vote. So, oh, go ahead, Steve.
So just to mention, some of us might have facilities that can host it. Not financially speaking, but like I have a huge meeting room, and Adam's got a huge meeting room, Dwaynesburg, and I think probably I mean, this is a nice room. This is an okay room, but you got all this stuff, all this stuff around. I mean, I just think that I'm sure that we wouldn't charge a fee, you know, we would give the sweat equity of hosting someone. And Adam, you might be willing to do the same, like for Dwaynesburg, to have one of these things.
I don't work with you guys.
Excellent.
That's very thoughtful of you, Steve.
Oh, she said, thank you for being thoughtful and offering. All right, anyway, as it relates to Town of Ashland CON vote, so just, you know, to recap, you know, earlier, an application was received at Remo, reviewed by the CON committee, deemed to be complete. And as a result of that, the public hearing that has been mentioned and noted in the minutes occurred back on January 10. And as reported, the public hearing was sparsely attended and there was no opposition presented at the time of that public hearing. So tonight, as it relates to the actions here by Remo, is so the forwarded motion to the group is to accept the results of that hearing, and your vote yes would be to issue a permanent operating license to the Town of Ashland. And we'll do that in the form of a roll call vote, and that'll be Carol.
Any discussion?
Or is there any discussions on the motion? I apologize.
We can close here.
No discussion. It's up to you then.
We're all good. Huh? All right. All right, so of the people that I have in attendance, so let's start with, confirm my list is here. PJ Keeler,
Yes.
Steve Meehan,
Yes.
okay, Steve Neer,
Yes.
okay, Kathy Allen,
Yes.
Ben Bornhorst,
Yes.
Tracy Weir,
Yes.
Jim Vina.
Yes.
I'll alternate these. Let's see. Dr. McHugh,
Yes.
okay, Dr. Daly,
Yes.
okay, Steve Kroll,
Yes.
Anne Marie Cross.
Yes.
Me, yes. Lynn Kane. Where'd she go?
I don't know. We have lost her.
Okay, Lynn is gone. All right. Jim Stairs,
Yes.
Dale Lingenfelter.
Yes.
Is Alan still on? Let's see, he was on there. He's on. Let's see, Alan on there. Okay.
No.
Steve Retzloff,
Yes.
Rich Salucci,
Yes.
Maria Walker. Yes. Charles Welge,
Yes.
Otto Madsen,
Yes.
Adam Fink.
Yes.
Okay, I don't see Paul Segura. And I think I got everybody, correct? Okay. well,
Jeremiah
unanimous.
Rod, I would be a yes.
Oh, I'm sorry, you're down at the very. Oh, you're not on my list, okay. Jeremiah Rod. And you're a yes, I take it? Did I hear that correctly?
Jeremiah Rod.
Yes. Yep.
Okay.
Yes.
Yeah, I've got two different lists, I'm sorry. He's on one list and not the other. Okay, you are officially on the list now. Okay, good. All right, motion passes.
All right, very good. We've already covered the Remo Arams operating loan process, and the next item. Interesting that we would have this like this. I always smile because once you're treasurer, you're treasurer for life. So I guess appointment might be more appropriate. But anyways, it's actually an election. So the current group of officers have all replied my email indicating that they would be interested and willing to continue to serve in the current capacities of chair, vice chair, treasurer, and secretary. So just in accordance with parliamentary procedure, I guess we have to do them one at a time, don't we, Steve, to be official?
Well, you need to open nominations.
Yeah, but I mean, we would still have to go 3 times for each.
Yeah, the one thing I want to mention, and I don't have an opinion on this, but you know, Tim sent out a note today saying, hey, let me know if you want to be an officer, and you know, we're gonna do this tonight. He didn't say we're gonna do this tonight, but I do this tonight. Just, I will not question it if we elect everybody tonight, but just if you look at our bylaws, there should have been, you know, I realize we don't have a robust nominating committee and we don't really have a good process. But I think, Jim, it would be good for you to just make sure you have a consensus of everybody that nobody objects to us doing this on the quick. Because technically, you know, we probably should have given people notice. They should have had a certain amount of time to submit a letter to Tim if they're interested. So, you know, you could do that tonight and say you have a week to get, and Tim to send out an email to people that say, you know, if you're interested, do it within a week. Again, if you want to do it tonight, I wouldn't object to it, but I think it should be at least a consensus of people here, since we're kind of going outside our process, the way the bylaws say we should be doing it.
Yeah, I mean, I have no problem with that, you know, again, the past practice and I guess according to bylaws is, you know, our January meeting is typically when we have elections. You know, and I guess it doesn't hurt to remind people that that's the process. So either way, I mean, does anyone have a strong feeling one way or another? Do we need to hold the election till February to allow persons who may want to serve in these capacities additional time to express their interest? Or, you know, again, do you guys feel that we've done our due diligence and the email?
That December meeting, I basically just sent it as a reminder, but it's up to you guys. Yeah.
Okay, I'm all for going ahead.
Okay. Excellent. Well, then we would certainly open the process to a vote and any nominations from the floor.
I'll nominate PJ for treasurer.
Excellent. I have a nomination by Steve for PJ.
A second.
Second by Steve, another Steve, sorry. And I was going to say with that, we could certainly do it one at a time, and I have no problem with that. So as it relates to the position of a treasurer, are there any other nominations for the position of treasurer? Are there any other nominations for the position of treasurer? Are there any other nominations for the position of treasurer? Seeing none, we'll have the secretary cast one ballot for PJ Keeler as treasurer. Congratulations or condolences, BJ.
Thank you, Mr. Chairman.
All right. Any nominations for the position of secretary?
Carol, you're secretary, right? Oh, I nominate Carol for secretary. I guess past chairs do the nomination.
There you go. Any second to that nomination?
I'll second.
Excellent. Second by Jim Vina. Any other nominations for the position of secretary? Any other nominations for the position of secretary? Any other nominations for the position of secretary?
Make a motion, the secretary cast one ballot.
Excellent. So I have a motion by Steve that secretary casts one ballot for essentially herself as secretary.
Do I have to do
I'll second
that?
Seconded by Pink. Motion carries.
I nominate Alan Bell, right? Alan's our
Yep.
vice chair, right? Vice chair. He didn't like, he's not like here trying to hide from the job as he can.
No, and Alan was here and apparently signed off, so he's in trouble. So I have a motion by Steve Grohl for Alan Bell for the position of vice chair. Do I have a second? Second by Steve Retzlaff. Are there any other nominations for the position of vice chair? Are there any other nominations for the position of vice chair? Are there any other nominations for the position of vice chair? Seeing none,
I make a motion that the secretary cast one ballot for Alan as vice chair.
excellent. Steve Kroll has made the motion, a second by Steve Retzlaff.
I make a motion, I nominated Jim Stairs for chair.
Excellent. Do I have a second? Steve Retzlaff. Any other nominations for the position of chair? Any other nominations for the position of chair? Any other nominations for the position of chair? Seeing none,
I make a motion that the secretary cast one ballot for Jim Stairs for the position of chair.
excellent. Second by Pink. That would be carried. Thank you all for your support. I don't believe we have any items of old business, any specific items from the floor. Seeing none, our next meeting would be February 27th. We'll see you then. I appreciate everybody's patience. Obviously, we often get out of here quite quickly tonight. Notwithstanding some important information brought by Steve and Anne Marie. So again, thank you for your patience and perseverance. We'll close the meeting at 7:15 and we'll see you next month. Yeah.
Yep. We have a meeting at 5:30 and then
sure
get off from the meeting.
Earlier today.
You there, Carol?